Today we will present about REAM framework and our team members are Miss Abir, Miss Ruqayya, Miss Menji and myself. Original of REAM framework, its first published articles in 1999 and it was intended to increase balance between internal and external validity. The goal of REAM was to encourage planners, evaluators, readers of journal articles, funders, and policymakers to pay attention to essential program elements, including external validity, that can improve the sustainable adoption and implementation of effective, generalizable, evidence-based interventions. Here we need to emphasize that implementation science is not only about research. It includes knowledge, theory, and practice. It is developing and testing a way to effectively and efficiently integrate the evidence-based practice, intervention, and policy into routine health practices. As a group, we read a lot of research and literature how to understand the implementation science. It takes us to incredibly hundreds of questions about human behaviors and organization culture. The organizational culture play a vital role in facilitating communication, commitment, decision making, and cooperation. So, what is REAM framework? It's a valuable tool for implementation scientists, health promotion professionals, and practitioners. It can be applied to assist with translation of research to practice and to estimate the public health impact of programs and interventions. Recently, REAM has been used to translate research into practice and to help plan programs and improve their chances of working in real-world settings. Features of REAM model that facilitate effective implementation. The implementation dimensions of REAM has traditionally been used to examine the consistency with which an intervention is delivered and the cost of such delivery. REAM model provides a framework to elicit contextual information to better interpret the effectiveness of interventions. Implementations is the dimension of REAM where the need of a qualitative understanding is most needed and often more meaningful than that of quantitative information. These issues include understanding the conditions and which consistency and inconsistency are occurring across staff setting time and different components of program or policy delivery. REAM framework strength and limitation. The strength of REAM is it is compatible with the systems-based and socio-ecological thinking and public health interventions, including randomized control studies and evidence-based medicine. It is admissible any kind of outcome that is quantifiable, reliable, valid, and important to scientific, citizen, and practitioner communities. It has a clear timeline. The assessment implementation is for 6 months to 1 year and the maintenance is more than 2 years. Available both individual level and organizational level. However, the limitations are REAM asserts the evidence should be broadened to include dimensions in addition to efficiency. REAM model does not explicitly include economic factors, cost issues. The precise nature of the relationships among the 5 REAM dimensions and how they combine to determine overall public health impact is yet unknown. And REAM framework doesn't capture such dynamic conceptualization of sustainability and has often been applied as a one-time evaluation and planning tool. Critical comparison between REAM, PRISM, and DSF. REAM is a tool that helps practitioner and intervention to understand the relative strengths and weaknesses of different approaches to health promotion based on 5 dimensions, where PRISM helps the practitioners to identify factors needed to successfully implement researched tested intervention in a practice setting and to measure the implementation success. And this conceptual framework examines how the following domains interact and influence: intervention effectiveness, intervention design, external environment, organizational characteristics, recipients, organizational and population based. Whereas dynamic sustainability framework anchors the ultimate benefit of the intervention in terms of its ability to fit within a practice setting, typically a clinical or community setting. What are successful features at REAM model? REAM model provides a practical means of evaluating health intervention, has primarily been used in studies focused on changing individual behavior. The relationship between change management and implementation science. During our semester, we were discussing about change management and we went deeply in different elements that support the change within the organization, such as organizational culture, leadership style, communication, and we shared different theories and model of change. Therefore, change management provides a structured approach for supporting the individuals in our organization to move from their current status to their future status. Implementation science is methodology help us what is precisely that we want to achieve. It's about translating knowledge about practice into practice, getting people more and move. By using a framework, we can create the link between the practice of science and the practice of behavior change and the change management. Research proves that there is a great value in effectively using implementation frameworks, models, and theories. Key considerations for successful change. The organization has to have minimum functioning systems and infrastructure for evaluation. The staff should have appropriate trainings and equipped with tools that they may need to conduct the evaluation. Use a team-based approach to prioritize improvements and implement them. Involve each staff in the evaluation process in some way, and develop and agree on how the evaluation will be implemented and who will lead the process and how it will be started. Involve participants in the evaluation process since they may bring valuable ideas based on their experience in receiving peer support services. As a group, we thought about adopting REAM framework, and to have so, we have to have the minimum functioning system at our organization. So to be able to re-evaluate the interventions and everything based on the 5 dimensions of REAM framework, we have to correct and revisit our quality measures in terms of calculation, methodology, formulas, and data collection. That's why we thought about adopting the IHI Era 3 Performance Measures Initiative by applying the REAM framework for planning and evaluation. Quality measures in healthcare is the practice of using data to assess hospitals and healthcare systems' performance based on various quality standards. The objectives of this project is to describe 9 elements to Era 3 in terms of REAM, research, effectiveness, adoption, implementation, and maintenance, planning and evaluation. Reach defined as individuals who are willing to participate in a given initiative, intervention, or a program, and reasons why or why not. The driver of this selection was the National Agenda of 2021. The National Agenda in 2021, this will result in the UAE becoming among the best countries in the world in terms of quality of healthcare by providing world health class services through ensuring that patient happiness rate is high. And the objective was position UAE as a global medical destination by introducing a value-based, comprehensive, integrated, and high-quality service delivery system. So the initiative adopt balance scorecard and develop annual objective at the level of the CEO at each business unit. By developing annual objectives as per the balance scorecard is the first step toward providing high quality services delivered. Effectiveness is the impact of an intervention on important individual outcomes, including potential negative effects, and broader impact, including quality of life and economic outcomes, and variability across subgroups. So, what is the current situation? The performance measures are scattered across the organization and did not provide the big picture of the organization status. We have lack of criteria that help us selecting appropriate measure and reflect the organization performance and identify the system gaps. Therefore, the happiness rate of our customers is low. We have different individuals communicating with internal and external stakeholders, the contracted service champions and the service level agreements between the organization are not monitored and therefore the provided service is not up to the standard. Lack of control on cost data collection, contracted services, and quality improvement projects, which lead to keeping the organization under stress of financial constraints. Although these organizations are accredited, however, obtaining health accreditation is not enough. However, the accreditation is arguably measure quality, safety, and efficiently, but do not adequately address system-wide consistency and overall. Adoption is the third dimension where it is defined as the absolute number, proportion, and representative of setting and intervention agent, where people who deliver the program or who are willing to initiate the program. So we, as a group, we came up with 160 measures that are reported to the CEO, and the same and some of the measures are monitored from different angles, which make the monitoring system scattered. So we came with a proposal of balance scorecard where the CEO is required to set his annual objectives as derived from the national agenda and the strategic plan, and the HOD department will develop a measures that serve the execution of these annual objectives. The idea is to understand the performance of the business unit and to be able to develop corrective action plan for improvement. So we set a criteria to select the appropriate measures as unified language. The indicator should have a clear formula, no abbreviation in the measure title. The abbreviation is defined in the measure description. The organization should have a control on the selected measure, which is very important, so they will be able to develop an action plan and improvement plan. And the measure is aligned with the annual objective of the CEO. This is the Gantt chart where it's part of the implementation and what is required and what is the milestone of each quarter during this year. And here we reach to the maintenance, which is the last step of REAM, where is defined as the long-term effect of a program on outcome after a program is completed. So we started with REAM and we extend our effort and our evaluation to sustainability by adopting the DSF Dynamic Sustainability Framework.